আজকে একটু ডাউন সিনড্রোমের রিস্ক নিয়ে ছোট্ট করে একটুখানি বলবো। ইফ ইউ হ্যাভ ইউর ফার্স্ট চাইল্ড উইথ ডাউন সিনড্রোম, then don't panic to bring your next child. Rather, consult a genetic counselor or clinical geneticist whenever you are planning for your next child. Because the reason of Down syndrome is always not the same. But in case of 90% of Down syndrome child, we usually find that there is an extra copy of chromosome 21, that's trisomy 21. That is usually the most common reason of Down syndrome. And in case when the child is suffering from Down syndrome, which is because of trisomy 21, in our next child, in our next issue, the chance risk of developing Down syndrome is around 1 to 2%, or it's just equal to the general population. But whenever in 10% of the cases, what we found, that is because of a chromosomal translocation. What is translocation? Translocation is exchange between two chromosomes of their parts. In case of Down syndrome, we found this translocation among chromosome number 1421, chromosome number 1321, and chromosome 21 itself. Whenever the translocation, this Robertsonian translocation, is because of a part exchange among chromosome 13, 14 along with chromosome 21, then the risk of developing Down syndrome is slightly higher compared to trisomy 21. We need to see the karyotype of that special child who is affected by Down syndrome, as well as we need to see the chromosomal status among parents also. If the mother is a carrier of this translocation, mother may be phenotypically completely okay, so he is not affected. She is just a carrier of this translocation. If she is the carrier, then the chance in the next generation of developing Down syndrome is around 10 to 15%. And if the father is a carrier of this translocation, then the risk of developing Down syndrome is 8 to 10%. And when the translocation is present in the child, affected special child, in chromosome 21 itself, and a parent is a carrier of chromosome 21 translocation, then the chance is around 100%. So it is very important that we should know the status of chromosomal problem among the parents and the child. If we know the chromosomal status among parents as well as the affected child, then the risk analysis will be easier and the panic will be less also. So I think so consult a genetic counselor or clinical geneticist before planning your next child whenever your first child is affected with Down syndrome. That will help you a lot. Thank you.